Welcome everyone to Mayo Clinic Q&A. I'm Dee Dee Steepen. Whether it be early menopause due to gynecologic cancer or hormone therapy due to breast cancer prevention, there are many obstacles that women with cancer face that may affect their sexual health. But women shouldn't suffer in silence because help is available. Joining us to discuss is Dr. Jackie Thielen, a Mayo Clinic general internal medicine physician in the Women's Health Clinic in Florida. Dr. Thielen, thanks so much for being with us today.
Thanks, Dee Dee. I appreciate you guys having me.
Can you tell us a bit more about the expansion of the Women's Health Center to the Florida campus?
Well, I'm excited that we are building on the outstanding work done at Mayo Clinic over the, last 20 years or so with regards to women's health. Mayo Clinic Rochester was actually one of the first health institutions to have an integrative women's health practice. And I was one of the founding providers in that practice. At that time, we were called the Women's Health Clinic. And now it's been renamed to the Menopause and Women's Sexual Health Clinic. But as that practice grew and our impact on education and research grew, we established a Women's Health Fellowship. And one of the first fellows was actually a colleague from Mayo, Arizona. And when she went back after her fellowship to the practice, she established a women's health practice as well for the Mayo Arizona site. Subsequently, now that I've moved down to Florida and moved to Jacksonville, I've had the privilege of encouraging the development of a women's focused practice down here. And in fact, as of June 1st, we opened the Women's Health Specialty Center. We're a little different than Rochester and Arizona in that we don't do primary care. But what we are doing is coordinating care through multiple different specialties. So in addition to the wellness checks or a GYN evaluation, you can also get a dermatology, vascular surgery, physical medicine, lots of different things that patients can come and see as well. So I'm excited about the opportunity.
Can you explain why integrated women's health services and clinics are so valuable for women?
Well, I think women's health in general is not focused on what we would call bikini medicine, and that's really about the breast health and the GYN health. Women are really simply not a smaller version of men. Our illnesses can be different, even though they may be the same illnesses. We may actually experience them differently. Obviously, some of our illnesses we have because of our parts, like uterine cancer, for example. Men, of course, don't have those. We also, though, find that women might experience these other illnesses, such as arthritic diseases or endocrine issues or even other cancers differently than men, purely by how our genetics and how our hormones and bodies work. Giving women an opportunity to really sort of see experts that understand that and can, of course, stay up on the literature, because this is really something that's really come to the forefront over the last 10, 15 years to really think about women specifically with regards to different kinds of illnesses. Again, not just looking at breast and GYN health.
What are some common issues that affect women's overall sexual health?
Well, sexual health is often a reflection of your well-being. You know, it impacts your physical body, but it's also the impact of your emotional and psychological self, how your relationship is going, as well as what makes you, your sociocultural experience. I think that it's important to take all those factors into account when assessing someone's sexual functioning. However, the most common complaint I probably see is that of decreased libido or interest. But when we start to really delve into what is the cause, again, all those aspects, it might be something physical like a thyroid disease or hormonal loss, but a little bit of stress, as well as perhaps some issues with self-image. And then you talk about the relationship, and yeah, there may be issues with communication or even a partner who has some erectile dysfunction. So again, it becomes much more complex than just saying one thing is the problem. And I think that's why for a long time, providers sort of wouldn't ask the question, because there often isn't one quick fix.
What advice do you have for women when it comes to talking about and seeking out information regarding their sexual well-being?
I encourage women to really go to their primary providers and ask. I know it's uncomfortable, but if they don't ask, unfortunately, oftentimes doctors won't ask. We just know that. And of course, as an educator, I'm trying to teach my new doctors to ask. And hopefully, we will have a generation that's more comfortable with this. But many people are not comfortable having the conversation. I think it's important for people to recognize that this is part of your overall well-being. And so it is important to ask a question. However, if you have a provider that's not comfortable with the topic, you can ask them, if you're not comfortable with that, is there someone you can refer me to? And that's what I do every day. Patients often are referred to me with their specific sexual health question. And there are many programs across the country now that have specific focus on sexual functioning. So you can find an expert. It's really about knowing where to look and just asking.
Can you share the related services women might be able to take advantage of with the Women's Health Clinic?
Our practice is called a Women's Health Specialty Center. Um, and of course, that's a distinction from the other practices within the enterprise. But what we do here, in addition to the wellness checks and potentially referral or assessments by gynecology, they can see me in the menopause and women's sexual health piece. And I work very closely with pelvic floor physical therapy, especially if there's a component of pain that the woman is having from a sexual standpoint. In addition, we have people to work with women if they have, for example, some stress management issues. Our integrative health program here is very strong. We even do massage and acupuncture and all those good things. So it really is sort of a nice opportunity to be in a place where you have expertise on many levels that maybe you didn't think about. But in general, as providers, we sort of keep those things on the list of things that can help you.
Well, we often think of women as caregivers for their families, and they may put off their own health care as a result. What advice or recommendations do you have for women about the importance of a women's well visit? And on top of that, does that change with age?
I encourage women to see, be it a doctor or a nurse practitioner, on a regular basis. And not necessarily because they need an hour visit every time, but it is an opportunity to check in, get your questions answered. But also, you may not be sure what the questions are. So as a provider, we're trained to ask certain questions to get an idea if there is a problem. And so some patients aren't aware that there is something that puts them at greater risk of a disease process, or perhaps there's some preventive screening that should be done. And so if you don't take the opportunity to see a provider, you won't get the benefit of those screenings. I also think it gives you an opportunity to check your numbers, is what I call it. Know what your cholesterol is, what your blood pressure is, because those things are really important for your long-term health, not just in the moment. I do know, because I certainly have been there, where being a mom who doesn't have time for pretty much anything, let alone going to the doctor. But we take good care of our cars, we take good care of our houses. I think we should be able to make a little hour appointment to set aside time just for us.
Next, what we're going to do is we asked you, Dr. Thielen, for some common questions that you get from patients. So the first one is, if no one in my family has had breast cancer, do I have to worry?
This is sort of an interesting one that I just sort of wanted to bring up, because it really sort of surprises me how many women don't know that the majority of breast cancer cases don't have a family history. The family history part, the hereditary component, is about 20% of breast cancers. And so if you're focused only on that, you're going to miss your opportunity to catch your own disease. And so it is important for women to recognize that we're women, we have breasts, we are at risk. there are certain risk factors that we actually may have control over that can lessen your risk. And some of those may be alcohol intake, your level of obesity. And so it's important for us to know that, breast cancer isn't something we just have to wait for. It's something that we can be more proactive about. And certainly if we find things earlier, the outcomes tend to be much better.
Okay, common question number 2. If I didn't have this tummy before, how do I get rid of it?
Boy, I wish I had $1 for every time I heard that question. Where did this tummy come from? And now I have that tummy too. So if I knew the answer, I would certainly get rid of it. And so that's the challenge. We recognize with aging that there is an increase in fat redistribution where our bodies just start to accumulate more in the middle. We go from the pear shape to the apple shape. And that isn't necessarily something we've done wrong. But the other component to that is as we get older, we lose muscle mass. And as we lose muscle, we certainly have a negative impact on our metabolism. So not only are we physically probably not as active at our 50s and 60s than we were at our 20s, but now metabolism-wise is not quite to the same extent either. So we gain weight. And then we go through this midlife menopausal change, and the weight gain happens where? In the middle. So I don't have a quick fix. Certainly it is about doing what everyone knows to be true. Calories out have to be better than calories in, and however that works. The challenge for women, however, is it seems that from an activity standpoint, we always have to keep building on that. You can exercise and get to a place where, nothing's much happening, and guess what? You have to exercise even more to get to that next level. And there is no quick answer, that's for sure.
Finally, the third common question you get, should I worry about osteoporosis?
Yes, osteoporosis is important. About 10% of the population will get osteoporosis, and that certainly is important. We don't want bones that are at risk for fracture. But at the same time, I think it's important for a person who's active, who has a good nutritional base, who doesn't have a family history of osteoporosis, who doesn't have health conditions that increase their risk of osteoporosis, like thyroid disease or some hormonal deprivation illness, that in general, our bones are usually pretty good. We can stay physically active, do weight-bearing activity, eat a nutritionally based diet that has good calcium and vitamin D, of course, get some time outside, and I get plenty of that now in Jacksonville. So it really is about doing the basics and not worrying. When do you do screening? In general, we start screening women at age 65. And it is important to know, again, if you are in one of those higher risk categories, because yeah, we might screen earlier. Again, that's where coming to your doctor on a regular basis to learn what your potential personal risks are will make a difference. But in general, I think if you focus on good exercise, good nutrition, healthy stress management, you're gonna, end up staying pretty healthy for pretty long.
Our thanks to Dr. Jackie Thielen, a Mayo Clinic general internal medicine physician and women's health expert. Thanks so much for joining us today on Mayo Clinic Q&A.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu. Thanks for listening, and be well.